Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist, and today I wanted to do a quick video on the subject of low blood pressure. Now, the subject of low blood pressure and blood pressure in general generates a lot of anxiety, and I've come across a lot of people putting posts up on Facebook pages, etc., saying, "Oh, my blood pressure is 90/50. What's going to happen to me? Should I be worried? Am I going to die? What's going to happen to me?" Okay, and I get a ton of people, and they say, "Oh, today my blood pressure was measured, and the GP said my blood pressure was low, and I'm very worried about that." And so I thought I'd do this quick video because I think that the worries about low blood pressure are in general unfounded. Okay, so the first thing to understand is that the blood pressure is a series of numbers. Okay, before you worry about numbers, it's always really important to try and understand what those numbers mean. Okay, because the number itself means nothing. What does the number mean? Surely the number has to represent something that's happening in your body, and therefore if that number is not within a range, then it should signify something that will happen to your body as a consequence. So the first thing always to remember is that we are all different, okay? And our blood pressures are within a general range. When people talk about absolute numbers, oh, your blood pressure should be 120/70, that set of numbers has been devised or decided upon by a bunch of professionals who don't know you. They're sitting in some room somewhere, dealing with populations. They're not dealing with individuals. The second thing to try and understand is that the blood pressure is a surrogate marker. Basically, what it tells you is that the heart has to generate a certain amount of pressure to push blood out into the body, and that pressure should be enough for the blood to penetrate your vital organs. i.e., if your blood pressure is adequate, then when the heart pumps blood out, that blood should be able to get into your brain, and it should get into your kidneys, and it should be able to get to your stomach, and it should be able to get to your skin. Okay, and as long as it's doing that, all right, as long as it's doing that, your blood pressure is okay. It's not low. The only time when the blood pressure is truly low is when the heart is not able to generate enough of a pressure to be able to get blood to the vital organs. All right. So if someone says to you, your blood pressure is 80/50, what you have to say to yourself is, am I conscious? Am I alert and orientated and not confused? And if you are those things, then clearly whatever your blood pressure is, the blood is getting to your brain. All right. Then you say to yourself, am I warm to touch? And if you are, then the blood is getting round to your skin. Next thing, am I urinating normally? If you are, then the blood is getting to your kidneys. And that's all that matters. It doesn't really matter what the number is. The fact is that whatever the number is, the blood is getting around the body. All right. So I often get called by nurses when I used to be a junior doctor. I used to be called by a nurse saying, "Oh, this patient's blood pressure is 80/50. Can you come quickly and see what's going on?" And I'll go there, and the patient's sitting there reading a newspaper. And I say to the nurse, "Well, what does it matter? It's a number. It doesn't mean anything. I mean, what it's supposed to represent is clearly happening." So now, if on the other hand you're finding that that you get dizzy, or you're blacking out, or you're confused, and every time you change posture you feel extremely dizzy and fall back, well, and then someone says you have low blood pressure, then it's very reasonable to say that that low blood pressure is clearly worth treating. And often the only thing you need to do to treat the blood pressure is to increase your fluid intake and increase your salt intake. I see tons of people who say, "Oh, but I was told salt is bad." Sure, salt is bad. It causes high blood pressure. But if you've got low blood pressure, then have more salt. and that's all that's needed. So there are lots of myths. People generally think, oh, salt is a bad thing, we should avoid salt, to the point that they'll be, extremely dizzy when they change posture, and they'll say, oh, yes, I've got constantly low blood pressure. And I'd say, well, do you take any salt in your diet? And they'll say, no, I don't take any salt whatsoever. And I say to them, well, clearly you must take some salt, because salt retains water. If salt retains water, and the more water there is, i.e. the more volume there is, the higher the pressure that the heart can generate. And that is a good thing if you suffer from low blood pressure. But as I say, please, please, please don't worry about numbers. Don't let your anxiety get on top of you about numbers. Ultimately, if you're functioning fine, do not worry about low blood pressure. All right. So I hope this little video was useful. And for those of you who worry about your blood pressure, stop worrying. All right. My name is Sanjay Gupta. I'm a consultant cardiologist in New York. I have a Facebook page, which is York Cardiology. The Twitter handle, although I don't tend to go much on Twitter these days. And I have a website, and you can get through to me on the website. Alternatively, you can ring my secretary, Jeanette, on 725-811. Thank you very much. I hope this was useful. Bye.